going to be talking about the silent symptoms of diabetes. Now, type 2 diabetes, the disease behind this is called insulin resistance. Hi, I'm Dr. Mona Morstein. You can find me at drmonamorstein.com. If you're new to my channel, please click on the subscribe button. Otherwise, let's get going. I'm going to be talking about the silent symptoms of diabetes. You should watch out for these top 10 warning signs. By diabetes right now, I'm meaning type 2 diabetes. Now, type 2 diabetes, the disease behind this is called insulin resistance. Now, insulin is made by your pancreas, and so when you eat, it senses that the food is broken down, and it's broken down to glucose, and that's in your bloodstream, so it's making and secreting insulin. Now, insulin is called the fat building hormone, and what it signals the body to do is to have cells take the glucose, bring it inside the cells, turn it into fat, and store it, right? Now, this is a decent thing to do. You're going to burn it when you're active and store it again and so forth. But what happens with diabetes is this insulin resistance, which means even though the pancreas is secreting the insulin, the cells are no longer listening to it. And they're not going to take glucose in anymore. And they're not going to turn it into fat in their cells and store it, right? So what you eat just sits in your blood vessels and raises your blood sugars. And when it reaches a certain number, you have diabetes, right? So what are the top 10 ways you may be noticing changes indicating you could be developing diabetes? Well, one is you're gaining weight, and particularly in the abdomen, what we call visceral fat. Right now, this fat, the abdomen fat versus the girly kind of hip and butt fat, it's this fat that tends to make the liver insulin resistant. And then the fat cells come along, and the muscle cells, and the rest of the cells. So if you're starting to notice, you know what, I'm putting on some weight, and you're getting into more developing that apple body type, that could be an early sign that you're potentially at risk of developing diabetes. Now, another symptom is fatigue. If you eat a sandwich and it just sits in your blood vessels, raising your blood sugar, that potential energy is not getting into your cells. It's not the coal that the ovens need to burn and for that cell to do what it's supposed to do, make energy, just beat your heart, do all of these things the cells do. And so it's not uncommon that people kind of start feeling fatigue, right? Because their food is in their blood vessels, not the cells. Now, you could also develop a skin condition called Acanthosis nigricans, which is patches of this dark kind of velvety skin. So this is a skin change that can happen as a result of the elevated blood sugars. And it generally happens on the face or neck or in your armpit or in the groin area, right? So if you're starting to notice, what is that patch? Another thing that can come with the patch is some skin tags. Now, if you're getting skin tags or patches, those are signs of blood sugar dysregulation. Now, what's the fourth sign? Well, a fourth sign could be fungal overgrowth, right? Think of making a loaf of bread. We have flour, water, yeast, and then what do we do to feed the yeast? We put in sugar. So if your body is a little high with sugar, then it could feed the yeast that naturally lives in your body. For example, women, the vagina, Vaginal yeast infections can be common or even recurrent. We could get jock itch, guys, right? Fungal in the scrotal area. Also on the skin, right? So we can get intertrigo, which is fungus here under the breasts or in other folded areas of the skin. So fungal overgrowth is a fourth way that we can have symptoms of developing diabetes. One last skin one, slow wound healing. So high blood sugars don't allow the body to work the way it's supposed to. Your immune system can be lowered and your healing can be lower. So if you're getting wounds easy and they're just like, why isn't this healing up? This should be healed. That's the last skin sign that could give you an idea. Maybe I should get my blood sugars checked. Another symptom is frequent urination. So when your body is like, well, you know what? We got a lot of blood sugar hanging around those blood vessels. If it's not going to go in the body cells, we're going to pee them out, right? So your body is going to get rid of it through your bladder and your kidneys, right? So there's more urination happening to get rid of that blood sugar. Another one is your eyes. You could have changes in your vision. If your blood sugar is getting higher, then you could start actually having blurry vision, or just what used to be able you could read or see clearly, it doesn't work anymore. Maybe you go to the eye doctor, but another thing to think about is, gosh, my eyes get blurry after I ate that whole pizza. maybe there's a connection, and there could be if your blood sugars go up as a result. Another sign is tingling or pain or numbness in your hands or feet. So when your blood sugars are getting high, that can start irritating nerves. And we can get what's called a peripheral, which means outside the body at the edges of it, neuropathy, right? So if you're noticing, gosh, why do I have some numbness or tingling, or what is that about? Then that could be an early sign. That can even happen in prediabetes, as well as, of course, overt diabetes. 2 more to go. Another one is lack of appetite control. So here's the deal. When your insulin is working really well and your body is sensitive to insulin and it's taking the blood sugars in, then your brain is getting signals that, okay, I just ate, I'm full, I'm going to be good for 5 hours, I don't need any more feed, we're ready to go. When that insulin resistance is happening, your brain is not getting the biochemical signals that say, enough, I'm done, no more food. It's not you. It's not your lack of willpower. This is biochemistry and hormonal dysregulation in your body that's driving you to eat more and have a larger appetite, right? The last warning sign is mood instability. If you've heard the term hangry, which is being hungry and angry, right? Because your blood sugar is low and there isn't glucose in your cells and your brain to keep you level-headed and happy, it's kind of the exact thing in the totally opposite way. Now you've got a bunch of blood sugar, but it's all sitting in your blood vessels. It's not getting into your body cells or your brain, and there can be a lot of mood instability. People can get irritated. They can get angry and frustrated, and you could be like, what is the deal? Why am I acting out, or why am I just inside feeling this way when I shouldn't be? And that can be because of your blood sugar. These are kind of the top 10 warning signs that changes could be happening in your body, indicating prediabetes or diabetes. Now, why believe me? Well, I know a little bit about diabetes. I wrote a book. You can get it on Amazon. It's really awesome. Now, I'm Dr. Mona Morstein. I hope you enjoyed this talk on warning signs of diabetes. If you like it, please click like. Otherwise, subscribe to my channel, and I'll see you next time.